Hello and welcome to the AOTF Intervention Research Grant Recipient Webinar Series hosted by the Boston University Omicron chapter of Pi Theta Epsilon. This is Maria Lopez, a second-year MSOT student at Boston University. Tonight, we will be hearing from Dr. Jessica Kramer, Melissa Levin, and I-Ting Hwang. Please type your questions in the question box on the right side of your screen throughout the presentation, and we will ask them after. Dr. Kramer, the floor is yours.
Thank you so much. I'd like to welcome you to our presentation. Next slide, please. We'll be talking about our project, Prepared, Parents Responding, Engaging, and Participating for New Environments for Children with Disabilities. I'd like to recognize a collaboration in this project for researchers at the Yale Lab and the Department of Occupational Therapy at Boston University, and our collaborators at the Heller School at Brandeis University who are unable to join us but contributed to this presentation. To provide you with an overview, I'd also like to recognize our valuable members of the advisory board who have provided really great insight and connection to the community as we've embarked in this work. To provide you with an overview, our project had two aims. The first was to establish this collaboration between multidisciplinary researchers. But today in our presentation, we'd like to share the outcomes of Aim 2, the findings of our initial research to establish the feasibility of an environment-focused, problem-solving approach. Background. Parents of young children with developmental disabilities embark on a lifelong process of advocating for physical, social, and service environments that meet their child's needs. Environment-focused interventions may be especially relevant for families with young children with developmental disabilities, or DD. As the research suggests, families of children with DD may be disproportionately impacted by environmental barriers. For example, the literature indicates that children with DD are more likely to live with parents who have a high school education or less, or who are below the poverty level. In addition, minority and non-English speaking families who receive health-related services report less satisfaction with care, more difficulty using care, and poorer developmental outcomes. So to ensure the effectiveness of environment-focused interventions, especially for those parents and families who appear to be most impacted by those barriers, these interventions must be designed to consider the needs of parents with diverse educational, economic, or linguistic backgrounds. So incorporating health literacy principles into the design of an environment-focused problem identification approach could improve usability for parents who are most at risk of encountering those barriers and who experience disparities in health services. If we think about identifying environmental barriers or problem identification, there are two initial actions that characterize what can then move to an effective problem-solving approach. That first is the need to systematically identify the cause of the problem. And second, parents must adopt an orientation to problem solving that is positive and adaptive. That is, they must believe that they can address the problem that they've identified. Yet, we know very little about the optimal approach to equipping diverse parents of young children with DD with the ability to identify these environmental barriers to their children's participation. So the purpose of our research, again, was to evaluate the usability of a new health literacy-informed, structured problem identification approach for parents of children with DD. And we had three research questions. One, does the problem identification approach change the type of participation barriers identified by parents? Two, can parents with varying backgrounds and experiences use this approach? And three, what problem-solving orientation do parents take when encountering barriers to participation with and without the approach? I'll now be turning this over to Melissa Levin, who will be talking with you about our methods.
Thank you. For our participants, we recruited parents from the Boston metropolitan area through early intervention and parent advocacy organizations. We included parents of children ages 0 to 3 who were receiving early intervention. The children had a diagnosis of a disability or developmental delay that was anticipated to have long-term support needs. All parents had to be comfortable speaking English. We did exclude parents who had previously completed advocacy training. We used a tiered enrollment process to ensure representation of diverse parents, including parents of children who identify as minorities, parents with a high school education or less, and families whose annual household incomes were less than $20,000 per year, which is the U.S. federal poverty level for a family of 3. If you take a look at the table, we interviewed 9 parents of children with developmental disabilities who are receiving early intervention services. Of the 9 parents, you'll see that 7 identified with at least one of the following characteristics, either as a minority, as a person with low socioeconomic status, or as a person who spoke English as a second language. In regards to procedures, to evaluate the feasibility of the structured problem-solving approach, we used narrative elicitation. With input from our advisory panel, we developed 3 stories to elicit parents' perspectives about barriers to participation. The stories were about 3 common everyday activities. The first was a family trying to have a meal together. The second, a mom taking her 2-year-old son to the supermarket to buy groceries. And the third, a mom trying to find a preschool for her 2.5-year-old son to go to after transitioning out of early intervention. Each story incorporated both explicit and implicit references to multiple barriers stemming from the home, community, and policy context. So let me describe the structured, environment-focused problem identification approach. This approach draws from health literacy and coaching principles in order to develop parents' capacity to identify environmental barriers to participation. The structured approach directs the licensed professional to pose open-ended questions and provide increasing levels of support to allow the parent to identify environmental barriers. Ideally, any licensed professional with experience in EI could deliver this approach. For step 1, also known as independent identification, after reading each story aloud, the licensed professional prompted parents to identify any barriers related to the child's participation. The prompts didn't refer explicitly to the environment, and this step allowed us to establish parents' ability to independently identify environmental barriers and then compare it with their ability to identify environmental barriers using the structured problem identification approach. Step 2 is the visual aid prompt. So parents were presented with a visual aid, which is what you now see on the screen, depicting a social ecological model. While parents referred to this aid, the licensed professional read the definition of the first context, so that would be the home, or what you see in yellow, out loud, followed by a prompt that reframed that definition into an open-ended question. Step 3, the general level prompts, are when parents continue to view the visual aid while the licensed professional provided more prompts, which each incorporated one of 11 general environmental categories, which were used in an existing intervention to treat transition age youth to identify environmental barriers. So for example, are things at home making it hard? Step 4, the specific level prompts, are when the licensed professional used an open-ended question format to ask parents if a specific environmental barrier in the home context, which had been referenced in the story, was affecting the participation of the child in the story. So for example, how about the chair or the spoon? At the completion of step 4 for the home context, the licensed professional repeated steps 2 through 4 for the community context for that same story. And at the completion of step 4 for the community context, the licensed professional repeated steps 2 through 4 for the policy context, again for that same story. After completing all steps for all contexts for the first story, this process was then repeated, beginning with step 1 for the next story, grocery shopping, and then again the next story, enrolling the child in preschool. Because each story was unique and because the interventionist was able to modify and use specific prompts based on which each parent shared during the interview, the number of prompts was not equivalent across all stories, contexts, steps, or parents. Transcribed responses were coding using ICF categories, including both environmental and non-environmental barriers. To operationalize a parent's orientation to problem solving, we further applied the social ecological model to characterize the nature of the interaction that would be required if the parent were to implement the proposed solution. And this resulted in 4 codes. Individual, the parent changes, so no environment interaction. Home, an interaction between the parent and the child or another family member. Community, an interaction between the parent and other community members. And then policy, the interaction between parent and a policymaker. All responses were also coded to indicate the section of the prompting approach in which it occurred. So by environmental context, like home, community, or policy, and by prompt type. Barrier codes were summed across parents and also across stories. Patterns of code frequencies identified without the approach, or known as step 1, were then compared to frequencies identified with prompts to consider the home, community, and policy context. Orientation codes were summed across parents and stories, and we examined the patterns of codes identified in response to environmental versus non-environmental barriers. And now I will pass this on to I-Ting.
Hi, I would like to share about some findings of this research. So, about our research question 1, we'd like to know, does this problem identification approach change the types of barrier identified by parents? So you can see here, without this approach, step 1, parents still identify a total of 121 environmental barriers across all stories. When using this approach, the number of barriers identified varied with the type of prompt given. So when they use the social ecological visual aid, which is step 2, parents identified 105 additional environmental barriers across stories, and then they identified the fewest additional environmental barriers with general prompts, which is step 3, only 5 environmental barriers. And they identified 112 additional barriers when they receive specific prompts, which is step 4. The context targeted during step 2 to 4 of the problem identification approach changed the number and types of environmental barriers identified by parents. Parents identified the greatest total number of additional environmental barriers when they were prompted to consider the community context, and the fewest additional environmental barriers when they were prompted to consider the policy context. However, across 2 to 4 for all contexts, parents identify the most additional barriers, aligned with the ICF-CY Environmental Chapter 5, which is Services, System, and Policy. They identify 82 environmental barriers, followed by barriers aligned with Chapter 3, which is Support and Relationships. They identify 57 environmental barriers. Without this problem identification approach, parents identified approximately 2 environmental barriers for every 1 non-environmental barriers. However, when prompted to consider the home, community, and policy context using this approach, parents increasingly identify more environmental barriers relative to non-environmental barriers, with 11.5 environmental barriers for every non-environmental barriers. About question 2, we'd like to know, can parents with varying backgrounds with experiences use this approach? So in this graph, we have all 9 parents, each represented by a bar. 2 parents identify more than 55 environmental barriers. Before using this approach, which is step 1, each of these parents identify more environmental barriers in comparison to the number identified by each of the other parents during the same step. When using this approach, which is 2 to 4, these parents identify more environmental barriers in comparison to the number identified by other parents with the same prompts. These two parents both reported advanced postgraduate degrees along with an annual household income greater than $80,000 per year. No other parents in this study share this combination of characteristics. These four parents identified 30 or fewer environmental barriers across all stories. On average, without using this approach, these parents identify slightly fewer environmental barriers in comparison to numbers identified by other parents during this step. When using this approach, the average number of barriers identified by these parents was similar to the average number identified by other parents. However, in comparison to other parents, these parents identify fewer environmental barriers when prompted to consider the community context. All four parents reported low socioeconomic status, with 3 below the federal poverty level. About question 3, we'd like to know what problem-solving orientation do parents take when encountering barriers with and without this approach. Parents' orientation to solve problems varied based on their perception of barrier. When parents attribute participation challenges to child's impairment or other personal characteristics, the majority of the proposed solution involved a change that required an interaction between the parents and a member of the immediate home environment, and no solutions involved interaction with others at the policy level. Conversely, when parents attribute participation challenges to an environmental barrier, the majority of the solution require the parents to interact with others in the community level or the policy level. So now I'll turn back to Jessica.
So when parents use the structured, environment-focused problem identification approach, they identified additional environmental barriers that they had not independently considered. The approach helped parents identify barriers stemming from the policy context, particularly related to the ICFCY Environment Chapter 5, Services, Systems, and Policies. Such system barriers are strongly linked to the social determinants of health. Strengthening parents' ability to recognize system barriers not only facilitates parents' ability to navigate such systems, but provides parents with the skills needed to hold service systems accountable to their children's needs. We also found that parents with a range of backgrounds and characteristics were all able to use the structured problem identification approach. Steps 2 and 4 incorporated the most health literacy and coaching principles and were associated with the highest number of identified environmental barriers. These principles appear to increase the usability for all parents. We did see that parents reporting lower levels of educational attainment and low annual income identified the fewest environmental barriers. Yet, these parents more than doubled the number of environmental barriers identified when they used the structured approach compared to independent identification. The ability to attribute participation restrictions to environmental barriers may be linked to parents' orientation to problem solving. Our findings suggest that after identifying an environment barrier, parents are more likely to generate solutions that require interactions with members of the community and policymakers. This type of solution may represent a more positive and adaptive orientation to problem solving. Relying on the community, including service agencies or neighbors, for support may reduce the stress and isolation often reported by parents of children with disabilities. Further, by identifying problems that stem from these social determinants, such as educational policies, the availability and quality of service providers, and reimbursement provided for services or equipment, parents may raise their own awareness of the political and economic factors that impact their everyday lives. Such awareness is hypothesized to lead to raised consciousness and feelings of empowerment and ownership over their children's participation. As such, parents may then be more willing and able to advocate for broader policy changes that benefit both their child and all children with disabilities. This study is limited by the small heterogeneous convenience sample, and we did not examine fidelity to the structured approach. Further research should explore the application of the structured environment-focused problem identification approach with a larger sample of parents and when administered by other EI professionals, such as occupational therapists or developmental specialists. In conclusion, guided by a social, ecological, and health literacy-informed visual aid, parents could identify environmental barriers to participation stemming from the immediate, community, and policy contexts. Study findings provide initial evidence that this approach may help parents of young children with DD attribute participation challenges to environmental barriers and adopt an orientation to problem solving that is focused on making changes to the community and to the policy context. We'd like to recognize AOTF Intervention Research Grant for funding this important work, and thank you.
Thank you for that presentation. So now we will begin our 10 minutes of questions. Our first question is, what do you see as being the next steps for this research?
Well, if we think about, in the beginning, we talked about what makes an effective problem-solving approach, and it begins with problem identification. So currently, our environment-focused structured problem-solving approach only has this problem identification piece. So we've already been working with our advisory board to talk about the next steps, which is actually solution generation and solution testing. So we would expand our concepts of coaching and health literacy into what the next step would be that in the future an interventionist or an EI professional would further then go from the problems to what the solution would be and does it actually work.
Thank you. Our next question is, do you feel that there's a way that therapists would be able to incorporate this problem identification into everyday practice?
I'm wondering if Melissa, our clinician, would like to answer that.
Sure. Yeah, and I can answer both from a clinician and also the parent perspective. Again, I am a social worker, but I also currently receive EI for my daughter who just turned 1, and it's interesting because each time I work with my EI professionals, they're demonstrating techniques and they're also having me share back and really model for them what I'm learning. And I could really picture having a clinician teach the approach, but then each week different issues come up in the environment, whether we're out shopping or we're going to a play group or we're trying to meet with friends in Boston. So I could really picture a clinician working on a week by week or session by session basis to adjust parents' perspective to problem solving and to make it a more adaptive, environment focused approach.
Thank you so much. We have another question. During the independent identification, did the parents name environmental, community, and policy barriers? And if so, what percentage?
I-Ting, did you want to show that slide again and go through in more details the environment barriers that were identified independently? So using step 1, parents identified across all parents and all stories 121. We see that that's about the same number that they identified, slightly more, both in step 2 individually and step 4. If we look at the next slide, this breaks down the aspects of the environment. These are the ICFCY chapters. So independently, if you look at that first row, step 1, they identified the most barriers in chapter 4, 32, and chapter 4 is attitudes, correct?
Yes, it's attitude.
And Then that was closely followed by Chapter 5, which is that service systems and policies. So we see a similar level. So it's not that they're not identifying environmental barriers. We just see that they're identifying more environmental barriers and more barriers at that system level, such as the attitudes of other service providers, which is what we see in Chapter 4 when we look at the community context, or more policy and system barriers, which is what we see with the policy context in Chapter 5 with 38.
Thank you for answering that question. Our next question is, can you speak more about how parents' attitudes changed after the problem identification approach?
I can speak to that.
Thanks, Melissa.
Sure. You know, it varied. I think there were some parents who were really surprised by the way that they thought differently after using the social ecological approach. And I think these were parents who, you know, faced like a lot of adversity in terms of participation barriers, and they would say, it's just so hard to think about the problem as existing outside of my child, when so much of what I think about is like my child's behavior, my child's, you know, like inability to follow some kind of a social norm. So there were definitely parents who it was like pretty shocking. I think there were some other parents who had some familiarity with this kind of environment perspective, or perhaps they had, you know, worked, their EI professionals had already spoken with them a little bit, not extensively, but given them some familiarity. So I really do think that it varied, but it seemed like across all parents, they did find the visual to be, you know, helpful and accessible, and it was just like a helpful cue to consider the stories.
Thank you, Melissa, so much for addressing that. We have our final question for the night. Do you feel that the problem identification approach would be generalizable to other conditions besides developmental delays?
I think that if we take as OTs our lens, that we recognize that the fit between the person and the environment really impacts their participation. This is echoed by the ICF and the ICF-CY's approach to saying that participation and engagement in activities of daily life are not just about a person's body structures and functions, but also about the environment. So there's nothing inherent in the design of our visual aid or the approach to thinking about how the environment impacts participation that's unique to developmental disabilities or developmental delays. So we would certainly need to do explicit research targeting other groups. This is based on a modification of an intervention targeting transition age youth with developmental disabilities to teach transition age youth how to identify and resolve environmental barriers. And we also see a problem-solving approach in that intervention has led to changes in knowledge and problem-solving, increased goal attainment, and parent reports of increased self-determination after the intervention in comparison with a comparison control group. So we are positive and excited about the opportunity to take our multidisciplinary team and use this in other settings and with additional parents.
Thank you so much. And thank you again, Dr. Kramer, Melissa, and I-Ting for this wonderful presentation and for sharing your research with us.
Thank you for having us.
Thank you.